the patient, we let them come in and allow the patient to relax and speak out, talking to the doctor as a friend. The patient should develop a trust and then they will open up, not worried about what the doctor is going to say. You should not be judgmental. Hello everyone, I am Dr. Colonel M. Sitaram. It was 1970-71. During that time, the country was gearing up for a war. They were looking for doctors. So we appeared for a campus interview and I was picked up by the army. So it just happened in a few days. And before we even completed our internship, we were sent to the war front. And I was one of those lucky guys who participated in the Indo-Pak conflict of 1971 and towards the Bangladesh, liberation of East Pakistan, and now it's called Bangladesh. And I saw action right from there. So these are the experiences once in a lifetime that every soldier feels. And for me, in the start of the professional career, such an exposure was priceless. Deductive powers and powers of observation fascinated me. I am a professor of medicine and I teach this to the students now that please note before the patient starts telling his or her symptoms, you should know so much about them that you should be able to correlate. Sometimes the patient doesn't tell you, but you can make out. For example, if a person comes to you and sits down, you can ask the patient, so does your wife complain about your snoring? He says, how did you know about my snoring? You know, to say, I know you're a snorer. And if you call your wife right now, she'll tell you how. So he'll ring up his wife. Am I snoring? Oh, too much, she says. And I ask her, if your snoring increases and decreases, increasing and decreasing, suddenly you wake up. He asks that, he says, yes, frequent, all the time you do that. He says, I have no knowledge about it. He hasn't told me about it. But by looking at the experience, by the facial appearance, by symptoms, and we could make out that this is a particular syndrome of respiratory distress at night. It's called sleep apnea. And we can spot it even before the patient describes it. When I got spare time, you can imagine I'm having great fun. Photography is one of the most lovable hobbies that I have had, and I had great fun with small, simple cameras, which later on, as time went by, better cameras came. In addition to that, of course, I do a lot of painting and sketching. Every time I will have some spare time in my office and there's a white paper, the looks at the white paper is inviting me to draw a picture. So I keep drawing whatever in front of me. And I did develop an interest towards music. Although I'm not a great singer, I found myself attracted to the instrumental music. And I also have been writing poetry. And I've got a collection of poems. So this is all our fun side of life.